everyone, I'm Anum, Saeed. I'm a cardiology fellow at the University of Pittsburgh Medical Center, and I'm also the co-editor for the American Heart Association's Fellow in Training newsletter. For our special COVID-19 pandemic edition, we are joined today by Dr. Katie Berlacher, who's the Fellowship Program Director at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. Dr. Berlacher, thank you so much for being here with us today.
Thanks for having me, Anum. It's a pleasure.
We want to get your perspective on how you have responded to the COVID-19 pandemic, particularly from the cardiology training program. So getting started, would you be able to elaborate on some of the critical changes that the COVID-19 pandemic has posed to your program and how you have responded to that?
Sure, absolutely. When I think about change, I first have to think about the challenges that we were faced with initially. And those are kind of three main buckets. One is safety of the fellows. Two would be education and training of the fellows in light of the crisis. And then three would be wellness, making sure that we are attentive to that, and that given all of the changes that we are still being thoughtful about any new kind of things that you might need from a wellness standpoint. As you know, from a safety standpoint, my first move was to pull everybody who was non-essential from the hospital. So anybody who was on any elective went home. You guys were kind of being less exposed to any patients that would potentially come in. So we really went down to a skeleton crew in the hospital and at night, overnight, making sure we are fortunate that we had PPE, and that we also encouraged our faculty to kind of be the frontline person, that if there was ever a time that a patient needed to be seen and a faculty member couldn't do it, we would save the fellow from going in then and also seeing the patient. We've encouraged people to use things like telemedicine and e-consults both in the outpatient setting and on the inpatient setting, so that we decrease kind of face-to-face exposure, which I think has worked pretty well. The second major thing that we did, obviously with kind of more than half of our fellows at home, was to think about education, because we're not doing face-to-face education at noon conferences or grand rounds or anything like that. So we moved all of our conferences to either Zoom or Microsoft Teams conferences. And that allowed us to not only see each other, but also to kind of show slides and have discussions. And then last but not least was our attention to wellness. I think one of the biggest things is to just openly talk about it and to say this is hard. And then to also push out resources from a wellness standpoint that you guys would potentially use, whether they were HVI or, our division focused, or our local GME or national resources.
That sounds great. And I'm obviously a firsthand witness of all of that. You touched on a little bit of some wellness strategies that you've shared with us and
Sure.
the fellowship and faculty in general. What are some of the resilience strategies that you would recommend to fellows out there that have worked using?
It's a good question and a hard question. And I think, there's no one straight answer, right, for wellness or for resilience. And so you really have to go with what you think your fellows need. I've really encouraged you guys to lean into the community, right? And so we've done things like a Zoom happy hour and Zoom office hours once a week, where we can get together once a week and kind of like toast each other and say, hey, how are you? And share funny stories, which I think we at least have one or two new marriage proposals in our fellowship over the past couple of weeks, which is exciting and fun to share news. And then the other things are to kind of push out, there's meditation apps that are free for docs. There's our local GME that's put out options for people who can do kind of therapy virtually. So all of those things are available. And I think it's my job to make sure that you guys know kind of the breadth of them, and to make sure that you get time for yourself, time for your family, time for you, encourage you to get outside and do the things that you need to do to stay well.
That sounds wonderful. And how do you think, in a broad perspective, how a post-COVID-19 training era would look like, and what are some of the issues that this era has highlighted, per se, that may be improved on from a graduate medical education point of view?
Sure. Good question. I mean, this has been a challenging and yet super exciting time for us to think about the ways that we need to change moving forward, not only from a medical standpoint and the medical care that we provide, but also from an education standpoint. As you've seen, we've all moved virtually. So we're doing everything virtual right now. And I think that was a huge pendulum swing. And I think in reality, afterwards, we're probably going to see it swing back a little bit into the middle, where we have what I call something that's more blended. We have blended both virtual and live options for all of our conferences moving forward, and that we kind of give and take a little bit in both, whether that's from a national or local standpoint. And then the second thing that I think this is highlighted is patients love virtual medicine. And we are going to need it at times. And that means that we need to train not only our fellows, but our faculty on how to do it, how to provide it, how to do it better, what our shortcomings are, those sorts of things. And so I think blended education in the future and telemedicine are going to be the two ways that we are massively changed moving forward.
That sounds great. Thank you so much, Dr. Berlacher, for giving us your time and sharing your perspective with us. This is going to be very resourceful.
You're welcome, Anum. It was a pleasure.